everybody, Dr. Laina here, and today I'm going to talk to you about some of the things to do if you've thrown your back out, if it's gone into spasm. So when your low back has gone into spasm, what's happened is that you've either pinched a nerve or you've thrown a joint out of alignment, and sometimes it's even something small that was just the proverbial straw that broke the camel's back. But it's given your body the message that that area needs to be protected, and it needs to be protected quickly. And so what your body will do is it will create a spasm in that area to help protect it so that no other damage occurs. Unfortunately, this can be incredibly painful. So if this has happened to you and you have a back spasm, the most important thing to do is to lie down and rest. So at first, what we recommend is just go and find a comfortable position. That may be on your side with a pillow between your knees, that may be on your back with a pillow under your knees or with your knees bent. The rule of thumb is really whatever position feels best for you. Try to get into a comfortable position so that your body can slowly relax. Then the second thing you want to do is you want to find a heat source to put on that area that's spasming. A magic bag in the microwave will work. You can even use a heat pad of some sort. And what you're going to do is you're just going to put it on a low level of heat and put it on that area that's spasming for about 15 or 20 minutes on and then 15 or 20 minutes off. That will start to bring some blood into the area. And as we bring blood into the area, that muscle can often start to relax. The third and possibly most important thing that we're going to recommend that you do is focus on your breathing cycle. The inhalation portion of your cycle brings energy into your body and will create more tension, whereas the exhalation can be very relaxing. So focusing on a different rhythm of your breath can help bring down that level of tension anxiety and have some of that fight or flight response turn off. There's a wonderful app that can help you do that we've created a video around. It's completely free. I'll put it in the description below. But the short version is to inhale for about a count of 3 and then exhale for a count of 4 or 5. So create a rhythm where your inhales are slightly shorter than your exhales. That extra exhalation, as you do it, you'll start to feel some of the tension coming out of your body. And focusing on really relaxing as you get into this shorter inhale and longer exhale will really help bring down that level of tension. The next thing that we recommend is if it's time to get up and move because you've been lying there and resting for a while, is to try a back support. So I really love this one. We just got it on Amazon. I'll put the link below so you can access it for yourself. It's fully adjustable and I'll show you why I really like this. So what a back support will do is that muscle spasm and tension that you're experiencing is there to help protect that area of your lower back. When you put on a good back support, not too tight, but just enough so your body feels some support, your body will now get the message that it doesn't need to tighten up the muscles as much because something else is helping to support the low back. And very often that'll allow that muscle spasm not only not to increase as you move around, but to slowly let go. So this is a great one. And the reason that I like this one so much is because of how easy it is to adjust. So when you put on a low back support, what you actually want to do is you want to put it just below the hip bones. So these hip bones that are sticking out of the front here, what I'm going to do is I'm going to put this main strap just below my hip bones. And I'm not even doing it up too tight. As you can see, I've just crossed it over. And then the reason that I like this low back support so much is it has these 2 additional straps that come around and do up so that I can adjust the tension. And so again, you can see that I'm not yanking this to make it extremely tight in that area. I just want some light tension so that I can feel that something's helping to help support this area of my lower back and in through my pelvis here. Very often, if you wear this around while you go through some of your activities of normal life, you'll find that your body will start to let go some of that muscle tension as the back support is supporting it. If you try this and you find that your spasm increases rather than decreases, it's too soon in the cycle of the spasm, and I would go back to lying down and applying some heat. In terms of stretching, if you're in the place where you can start to move around, but the spasm, you're concerned it's going to come back, Please don't do any static stretching. So none of this touching your toes or bending over at your waist, because trying to get that spasm, if trying to pull it longer, will often make your body double down on the tension that was there in the first place. Instead, we want to do some gentle mobilizations and resets of the area to allow that spine to regain its natural function and curvature. Probably the best one out there is what we call our rocking stretch. So I'm going to put the full video on how to do this down in the description below, but I'll demonstrate it for you quickly here. All that you're going to do is you're going to get on all fours. So you're just going to have your hands under your shoulders and your knees under your hips as you get on all fours. And then the most important part of this stretch, of course, is not to let your head hang down. You want to look slightly forward as if you were about to crawl forward and you were going to look at the horizon. Keeping your shoulders relaxed and keeping your head up so that your spinal curves are maintained. You're just going to start to do very slow motions, rocking back and forth. So don't feel the need to do giant motions as you're in spasm. We're just going to start to do very gentle motions. You'll start to feel this starting to open up your lower back, starting to get your pelvis to move properly. And after you've done this for about 5 to 10 times, you'll start to feel that you can increase your range of motion. So of course, the most important part of correcting this back spasm and making sure it doesn't return is correcting the underlying root cause. Sometimes spasms are recurrent because when they come up, the underlying root cause of the issue isn't addressed. People take medications, which of course we completely understand. Who wants to be in spasm? And it helps some of the pain and tension go away. But then they haven't taken the time to discover the underlying cause of the spasm and heal it at its source. So please give us a call so we can do an exam and possibly some x-rays and determine the underlying cause of this issue and correct it at its source so the spasm doesn't come back. We really hope that this was valuable to you. And if it was, please press like. And if you have any other questions or anything else is going on with your spine that you'd like us to make a video about, please leave that in the comments below and have a great day.